Hello, this is Dr. Hufstader, and I wanted to take a minute to talk to you about the proper diet for somebody who's suffering with depression, attention deficit disorder, even schizophrenia and other psychological problems with brain function, and the right diet for this sort of patient. Because in our office, because we don't prescribe any drugs, we make moderations to the diet and nutritional supplementation along with some other types of therapies to treat these problems. We do it quite successfully. But the cornerstone of treating any kind of psychological problem, whether it be depression or schizophrenia or obsessive compulsive disorder or addictions or any other sort of brain problem, is what's called the ketogenic diet. The ketogenic diet, and the benefits of this diet for these sorts of problems was discovered many years ago, back in the dark days of psychiatry, when sadly lunatics, as they called them at the time, would be locked up in insane asylums and frequently forgotten. They'd be, the worst among them would be put into a straitjacket and put into a padded room, and that would be the end of it. Frequently forgotten in there. Now, when these patients would go into these rooms and end up being not fed for 2 days, 3 days, essentially what happens is they begin, just like any sort of starvation diet. Anytime you don't eat, you go into a mode where you are burning your own food stores, which are mostly fats and a little bit of protein, but you're basically consuming mostly fat. So when you're on a starvation diet, you're on essentially a diet that's composed of nothing but animal proteins and animal fats, yours. So this is the quintessential ketogenic diet, because when you consume these sorts of calories, one of the byproducts of it is what's called a ketone, Ketone, ketone. What they found when they'd forget about these people locked up in these padded rooms, and they'd say, we put Clarence in that room on Wednesday, and it's Saturday. We better go check on him. I'm sorry, I forgot all about it and forgot to tell you about it too. And they go in and check on Clarence, and I'll be darned if he wasn't improved. I mean, and not just because he was weak with starvation, he was honestly improved. His mental outlook and mental function had improved. And these reports came from all over the world around this time. And they discovered subsequently that it was the change in the biochemistry and the change in the nutrition of the brain that caused the change in function of the brain, made it more efficient, and it became this type of diet, this ketogenic diet. It became for a time the cornerstone of treatment for these sorts of problems. And it was done quite successfully until the introduction of psychotropic drugs, which then became the treatment of choice, and it still is now. It's the standard of care for these sorts of problems, the psychotropic drugs, which are loaded with all kinds of problems, and there's no reason why anybody in their right mind would choose to take a psychotropic drug if there was another alternative, and there is, and it's this ketogenic diet. Forms the cornerstone of the alternative. Now, how the ketogenic diet is done, you can just starve yourself, but it's not likely that most people will be willing to starve themselves for this purpose. But essentially, how this is done is you consume, and obviously there's more details to it than this, and if you're interested, you can email me or call our office and schedule an appointment. We can come down and talk about it. But the nuts and bolts of it is that you would consume limited quantity of carbohydrate. And for starters, you'd do 20 grams per day. You would test the ketones in your urine by using a simple diagnostic device called a keto stick, which you can buy at Walgreens or CVS or something like that. At 20 grams of carbohydrates, you will be producing ketones in your urine. You gradually increase the amount of carbohydrate each week until you are not producing ketones in the urine anymore, and then you reduce the amount of carbohydrates by 5 grams per day to where you are just producing ketones. The goal is to consume the maximum amount of carbohydrate while still producing ketones in the urine. Once you reach that point, and that might be 20 grams, it might be 50 grams, it depends on the person. But once you reach that point, which is the critical carbohydrate level, you stay at that level and you count your carbohydrates like it's some sort of religion. And you do that for anywhere from 3 to 6 months. And this forms the cornerstone for an alternative treatment for these types of problems. And we've had great success with that. We do include, like I said, other therapies and other nutritional protocols, but without the ketogenic diet, it becomes exceedingly difficult and, in my experience, impossible to gain any ground with these types of patients with these psychological problems. So I hope this was helpful to you. I hope this raised some questions, and I hope it was insightful. I appreciate you listening, and I'll see you again soon. Bye.